promote cancer screening and monitoring. Advice on when and how to screen. You may be surprised to learn that we can often identify health concerns before they cause noticeable symptoms. Yes, screening tests can find cancer early so that it can be treated. But the way we talk with our patients about screening can affect whether they get these important tests done. Let me share a few stories of how I explain when to do the tests and what they're all about. Colon cancer. When Elias turned 50, it was the perfect time to talk about colon cancer screening. I advise starting at 50 years of age or 40 with a family history and testing every 5 years. I told him about the fecal occult blood test that checks the stool for blood. If a closer look inside the colon is needed, they could do a colonoscopy. I encouraged Elias to schedule his first screening. Think of it as a birthday gift to yourself, I told him with a smile. Liver cancer. Even though Tomas had stopped drinking alcohol, I was worried about liver cancer, which often doesn't show symptoms until very late. Although he felt fine, I recommended seeing a health professional about screening because of his history with alcohol. High-risk patients like Tomas may be screened with a liver scan, ultrasound, or tumor marker blood test at time periods determined by a health professional. His journey showed me that a patient's past is just as important as the present when thinking about their health needs. Prostate cancer. Last week, I spoke to James, a 51-year-old, about prostate screening. He was late, as we usually recommend beginning at 50 and then every 2 to 4 years, or at 40 for high-risk individuals like him with a family history. Noticing his nervousness, I gently explained the rectal exam, which involves feeling the prostate for any lumps. I added that a PSA blood test could also be done. James bravely went for his screening, and I am so glad he did. His prostate cancer was found early enough to be treated. Breast cancer. When Princess came to see me about breastfeeding her newborn, it started our conversation about her breast health. I showed her how to check her breasts every month and advised her to have a health professional examination every 2 years. Looking ahead, I added that at 50, she should start having mammograms, a type of X-ray, also every 2 years. These breast health practices were an important way of looking after herself and her new little one. Cervical cancer. This morning, I had a heartwarming moment with Amy. I helped her with contraception many years ago, and now here she was, asking about cervical screening for her own daughter. I reminded her of the pap test, which looks at cells from the cervix, starting at 21 years. Every 3 years if normal. I explained the alternative called a VIA, which uses acetic acid on the cervix to see abnormal cells. I also recommended HPV testing if available, every 5 years from ages 25 to 65 years. Discussing health across generations reminded me of how our work touches our families over time. Lung cancer. I remember speaking to John, a smoker, about lung cancer screening. We discussed a chest X-ray, which can pick up lumps. Yearly CT scans, starting at age 50, may be recommended for people with a higher risk, such as those with a history of smoking, or who smoke a pack a day, like John. I made sure to remind him that stopping smoking and regular screenings could make a real difference to his health. Remember, by encouraging early cancer screening, we're potentially saving lives. When talking about screening, make sure you know what tests are available in your country and when they are recommended.